Good afternoon.
Hi there.
Call this session to order, and the official handover of the ministry from the outgoing Cabinet Secretary.
This afternoon, Honorable Minister, one is the official bit where we sign on a handing over instrument which comprises of where the ministry is at, where we are coming from as the Ministry of Health, and what remains for you to carry on with. And therefore, I will invite us to do that part first, and then we can open up to some remarks. Isn't it? Thank you. Thank you. That belongs to you, Honorable Minister.
Asante sana.
Welcome on board.
Thank you very much. Thank you very much indeed.
Component colleagues and Honorable Minister is a few remarks just to share with you my reflections on where we are at, and be able to also share some reflections on what awaits you as you come in. But before I make any remarks, allow me, Minister, to first of all congratulate you very, very heartily for being now the Minister responsible for health in the Republic of Kenya. I have no doubt that in the choice that the President made, you will be able to take the baton and run for the remainder of the kilometers within the President's administration, and so I congratulate you. Allow me to also most sincerely thank Rashid and my colleagues who are not here, Dr. Mercy, the CAS Health as well, the PS, the acting DG and the heads of directorate, but also all the people that I worked with, including you, Rosarine, and the team of my front office that has been very, very instrumental in helping me steer the ship and deliver what it is we have managed to deliver so far. Minister, I wish to take a few reflections, and as I do, just to again invite you to the Executive Order number 2 of the year 2013 May and the Health Act, as well as the 4th schedule of the Constitution, which are in a way going to be what determines and guides the remainder of the work that you'll carry on to do. They have guided me and interpreted in terms of the interventions that we make as a sector. I wish to reflect that I took on leadership of this ministry in February of the year 2018. I have steered the strategic interventions that have been geared towards equitable access to affordable health care by over 40 million citizens. I have enjoyed very, very high commitment by the technical team, but also the support team that I have worked with, and I really, really want to appreciate all of them. There has been an overall improvement in access to health in the 2 years. More Kenyans are able to have facilities which are closer to them, and they've been able to access wider variety of services, which also include the specialized services. Some of the strategic interventions, Minister, that we have put in place in the time I have been leading this team include the following. One, the universal health coverage. You will recall that when the President pronounced himself on universal health coverage was December the year 2017. And I came in a few months later, and we did commence what was considered a phase 1 of UHC as a pilot scale, covering 4 counties of Kisumu, Machakos, Nyeri, and Isiolo. been successful to the extent that we have learned lessons that have informed partially the plan that we have for the national scale-up. I'm also pleased to note to date we have signed 44 inter-governmental participation agreements, 44 counties, which spell the journey ahead in terms of UHC. In addition, colleagues, Honorable Minister, I did set up within that time 2 advisory panels, which I constituted to provide my office with expert advice on needed reforms in key aspects of UHC. One is the health benefits package, a health benefits package which is expected to give Kenyans affordable and responsive healthcare services. And the second panel was on health financing reforms, specifically focusing on NHIF. Both have worked very, very professionally, and indeed part of the reports I'm handing over to you today contain the recommendations from these experts. In addition to that, Honorable Minister, one other strategic reform that I was spearheading was to do with KEMSA beyond its levels of efficiencies today. And for these, again, we did contract a consultancy by the name Dalberg, who also have completed the rapid assessment of the capability of this institution. And again, I will be handing over part of that for your consideration and implementation. I want to just take a reflection on a few of the other areas that, Honorable Minister, you will perhaps carry forth in terms of additional focusing. One has to do with the issue of strengthening the human resources for health, a very critical input into UHC. Today, the national health workforce density for a core health workers stands at 15.6 health workers for every 10,000 population. This is below the 23 health workers for every 10,000 that is required under WHO or guidance. We have expanded KMTC so very much that last December we had 12,800 graduates from that middle level institution, which is one of your parastatals. We have also brought in additional support from Cuba through a memorandum of understanding, and they have done some commendable work in terms of specialized work, but also supporting in the out of urban areas and into the rural areas. Minister, when it comes to issues of health products and technologies, we can record a few achievements which I live proud of. One is introduction of the HPV and malaria vaccines that all happened last year. I did also, on directive from Cabinet, set up a mental health task force to study the causes of the increased mental health issues, whose final report will be with you inside a week, but for which I've also prepared an interim report for you. There are several bilateral memorandum of understanding in health cooperation. In the two years I have been here, 18 of them have been entered into. Again, I'm handing them over for implementation by you. We have developed in that period 32 policies, guidelines, strategies for various interventions in the health sector, again part of your entry. We have also strengthened the relations with our multilateral partners, which include the Global Fund, which supports us to fund HIV/AIDS responses, TB and malaria. Again, in the last cycle of replenishment, which happened last calendar year, and within this very financial year, we saw 17% increase in the grant from Global Fund, which will count for March. Honorable Cabinet Secretary, listening to that, one would think we haven't run through challenges. Let me take a reflection on the challenges which you will need to confront and for which you have an able team around you. One is around health financing. The high cost of healthcare, both for direct and indirect cost, remain a barrier to access. It must be that for us to realize UHC, the issue of cost of healthcare will need to be addressed. A fund allocation to health at the county level and national level needs to be ring-fenced so that there is a certain percentage that goes towards health. There has been inadequate resources to support emergency referral cases. Again, under the Constitution, emergency healthcare remains one of the rights. And again, it's an area which the team has a draft policy which you'll be reviewing and perhaps progressing to implementation. The transition of donor funding of strategic programs, which has led to reduced funding for HIV and AIDS, malaria, TB, the National Blood Transfusion Services, but also family planning commodities, again, is an area which you will need to have your eyes monitor very, very closely in terms of ensuring that there is expansion of alternative domestic resources. On service delivery, the area of vaccine and commodities, again, Honorable Minister, is one where the team will need to help you in terms of ensuring we do not get exposed to stockouts, particularly of the critical commodities that we need. Going forward, I wish you very, very well as you come to settle in this ministry. Just to remind us that we have just now execution of the contingency plan for the coronavirus. We also have a similar plan for Ebola and medical emergencies. I have signed on to the contingency plan for the coronavirus, and you will be taking on to be able to implement and progress that forward. We also have online 10 cancer centers and cancer prevention education campaigns, and a national cancer prevention education program through campaigns. And again, that is something that will need to be taken up to the people faster than perhaps we have done in the past. In terms of coordination with our partners, we have thousands of partners. We have just developed and signed off a partnership framework, which again will be for you to move forward. I will rest my case here, Honorable Minister, by wishing to thank all the teams that have been of support in the time that I've been here, and including also the media. We have been in this room several times, just updating them on what's happening in the sector. But also to my colleagues, the two CASs and the PS and the DG who have led the technical team. I want to take this opportunity also to extend my deep appreciation for the partners who have been supporting this ministry, supporting my office very directly, and who are committed and will continue working with you. I take this opportunity to wish you all the very best in your tenure in this ministry. Honorable Minister, it's for me now to ask you to make remarks as you take over this very vital docket.
Let me start by thanking you very, very much, Madam Cabinet Secretary, first for the very smooth manner in which you have executed the transition from the work that you've been doing and the work that we are going to continue doing. And also to say, having heard and read some of the work that you have been, some of the things you have been working on, I thank you, because we are taking over from a fairly organized, system, and therefore we can only continue the improvement process of the ministry. I wish to state from the outset that I am coming to a ministry, as you rightly said, that is very personal to people. You know, health is very personal, and therefore I appreciate the challenges that you have spelled out, but I also appreciate the base on which you have set for us to be able to overcome those those challenges. On my part, I look forward to working with the team that you have got in the ministry. Obviously, a new person comes with new ideas. The working style of one cabinet secretary is not the working style of another cabinet secretary, and I'm sure you'll be introducing your style in the ministry, and perhaps there'll be a few things that that people might find a bit different. But by the end of the day, we are all working towards the same thing, and the ultimate goal is to have a nice experience for me between our service provider and a patient. That's the long and short of it. You know, the long and short of it is we are all here for only one purpose. What is the relationship and what sort of experience are Kenyans having between a service provider and the patient? That's what we do. And you know, it can look very complicated, but that's what we do. So I am here to learn as well. I am new in this ministry. I don't have the experience you have here. So I will also be calling on you as we go along. We are working for the same government. So I'll be seeking your support and ideas also. Fortunately, we also have a good team of Dr. Rashid and Dr. Masim and the other team that is here. So I'm a sort of a student. You know, the beauty of a student and the beauty of somebody coming from a no knowledge perspective is that they are allowed to make any stupid statement, because I'm not qualified, so I can't say anything and I can just be corrected. That's the advantage. So having said that, I also want to thank the media, and because I have a basic understanding of media, I've got a feeling that they are not quite interested in other stories I can tell. They have got things that they want to hear. So why don't you ask?
Immediately.
Yeah. Yes.
Now that you have been,
I think it is not even what I'm doing differently, is what the government is doing differently. First and foremost, I'm sure you are aware that this morning an executive order was issued by the president regarding the management of and care for citizens vis-a-vis coronavirus. That's the first step. It is not that this work has not been going on. The work has been going on, but I think that today what the executive order looks at is the structured manner in which we can manage, you know, the issue of coronavirus. It only happened a few hours ago. So, and as you are also aware, the executive order envisages a situation where me as cabinet secretary now for health, we will share that responsibility, and it is not we take it with the seriousness with which the president issued the order. So yes, we are starting from there. I'm starting from there, from the chairing the committee that has been set, and work has been going on in the ministry. You are aware that yesterday Dr. Rashid had a press conference and gave quite a bit of material on the response and what has been happening in the ministry. I must confess that you did not cover him sufficiently. It is also
They covered me.
it's also good to be honest with each other. But he did spell out a few of the things. But more importantly, going forward, because I think the question focused more on going forward, the executive order also details out some of the activities and actions that we have to take. For example, in terms of our surveillance capabilities, in terms of our, what did you call it, Rashid? Not quarantine. Isolation capability, quarantining capability, if we came to it, the human capacity that we have in the ministry. And we are lucky because we are not short, we don't have a shortage in that area. As you are all aware, we had a team 2 years ago that went to Liberia, you know, and who are trained by WHO on the management of infectious diseases such as the one we are facing, very few countries can boast of the kind of capacity that we have to manage them. So I think that on the whole, starting with this executive order, we have a structure in which we can manage. I think the important thing is for us to appreciate this. This is a global pandemic. It is not something that is happening to Kenya. We are very, very lucky, and we keep our prayers that the current situation is sustained where we do not have a Kenyan or a foreigner in our country, who has died as a result of this disease. We can only hope and pray that. And I think it is very important for us as a nation not to panic on the matter. Instead of panicking and instead of fearing, the important thing is for us to think very, very carefully. This is the way we have managed so far. We've been lucky. It can happen that we get it in our country, so that when we do, we are ready for it. And I can tell you that this committee is going to make sure that everything possible is done to make sure that Kenyans are safe. And that's the end. That's the end result. That's what we are trying to do. Yes. Can I start with the last one?
No problem.
No, I'm not aware.
He's been suspended.
I am not aware. My friend, I've been in meetings the whole day. So if somebody has been suspended, I don't know. And quite frankly, and I didn't suspend him, I don't know him. But again, with all due respects, we are not in Kenya Airways. What happens in Kenya Airways? Who gets suspended? I don't know whether this is the reason, whether this is not the reason. I don't know. And therefore, I think I would be. I'm not qualified.
All right, we are telling you he has been suspended now.
And you are telling me that
suspended because these reasons have been given
by the ministry.
Yes.
Okay, I don't want to speak for Kenya Airways, so I will not discuss his suspension. But in my view, as far as the reaction is concerned, I think we have a free press, we have a free media. I don't think this ministry has prohibited anybody from covering anything. So I can only speak for us. I can't speak for any other institution. I would like to believe that that is not why, and they have got their own reasons and their own politics. But I'm not there, and I can't speak for them. Sorry, what else did you ask?
The reason I wanted her to answer this is because she's just handing over.
Yes.
And there could have been plans in place already. She said that is one of the things that she's handing over to you, the coronavirus. So I'm asking, because this happened before you took over, don't you think the way Kenya has handled the situation, even allowing that flight in here, was a mistake? Just a direct answer.
I don't think you'll get a direct answer, Ken. And the reason you won't is the following. WHO guidelines on managing this epidemic.
Oh, sorry. Why don't you just move a bit closer, and then we keep on shifting rather than moving everything.
Now we are done with this one. Ken, the reason you will not get a straight answer is the following. I'm inviting you to study the WHO guidelines on managing this epidemic and any other in the past. That one of the things that you ought to do is make decisions on account of facts, not emotions. Manage the spiraling of emotions that we are fanning because of the way we report. And therefore, I am not in a position that you can get a straight answer. Ken?
But looking at the reactions from morning, the executive order, there's a court order, and now there's something I've just read in the Star talking about a directive from PS Kinyua. All this, looking at the reactions the whole day today, this isn't something that we should have had like yesterday.
Minister Mutahi confirms, and I want to reiterate that what it takes over is a build-up of interventions that have been happening in the last close to 2 months. You adjust your interventions, you scale them up depending on how the epidemic is evolving. I met you didn't come in person in this very room, and we gave a detailed presser about a month ago. The problem had not even gotten out of China, Wuhan. So as the problem escalates, as the numbers increase, as more countries come under net, right now we are at 35, you respond differently. The minister is right in observing that we have an isolation facility. It's been there. Would it be adequate in the event? The answer is no. That is why we are moving on to widen that, just as a matter of preparedness. In any epidemic or any disaster, you actually develop and grow as you move. So there existed a structure. It's been found that it needs to be expanded. The one that the minister is chairing now, it's been given additional mandate. It's even brought in non-governmental organizations, including Red Cross, just again to heighten our levels of preparedness. So colleagues, I want you to go out of this place not thinking government was sitting waiting. Government has been in motion, indeed, and a lot has been happening. Okay. But it comes a time, if things were to change and the figures, and God forbid, we will respond differently. Okay. So the first thing is having a sound governance structure that brings all the actors that are necessary into the fore.
Okay. Right, next, over there.
Gloria Milimu from K44.
As you know, we have, yeah, I can see the technical people wishing to talk. We have, is it 5 in every
county?
In every former. There are 12. There are 12 level 5 hospitals spread around all over the country, and the beauty of the level 5 hospitals is a lot of them have got good capacity and capability, and that's why they have been selected as the ones. We must remember, there is no guaranteeing that this, if we have a problem, it will only be in Nairobi. We don't know that, and therefore, with foresight, and this is what Kanujugu was asking, you know, what is it you have been doing? We are not doing this because we have patients right now. We are doing this as preparation for anything that can happen. If it doesn't happen, thank God, you know, then all we will have done is made preparations. If it does happen, then we will be on the spot and ready for them. So yes, there is level 5 hospitals, there is Kenyatta Hospital, you know, that there is both the level 5 and the level 6, and also, as you can hear, Bagathi as well is an additional resource that we are going to use for the same purpose. So I think this, let's keep in mind, and I repeat this, let's keep in mind, this is preparation. We are not treating patients in those places. We are preparing for any eventuality. That is government responsibility. In addition to that, I think the media can also assist in passing information that we are going to start producing regarding what is citizen responsibility towards this disease. Hygiene issues, people keeping on washing their hands. If you look at the internet, and you are all conversant with that, the internet in other countries, Singapore and elsewhere, they are issuing statements such as those ones. They are saying, what is it we should be doing as citizens? How do you protect yourself as a person, you know, from this epidemic? And I think that the media has that responsibility as well.
Absolutely.
You know, to spread that information. You have got journalists who are in the medical area. You also have a responsibility. Start spreading it around. Tell people, protect yourself in this manner. You know, let's not just criticizing, you know, what is the level of government is not doing enough, government is not doing that, government is not doing the other. Fair enough. You're the fourth estate. That's your job, to highlight issues. But at the same time, you know, let's not cause panic. Tafadhalini.
Let me respond to this lady, Minister. You talk about the issue of contact tracing, right?
Yeah.
Now, the issue of contact tracing did not even require any court order. And the reason it never required is when the travelers, are coming into the country, the travel manifest is with the gentleman on my right here as a routine. They will get their contact details every day. They will follow up and give the messages which we've been pleading with you to circulate. That if you get any symptoms of this nature or that nature, present yourself. Let us know. And this is the work this team, led by the DG, has been doing long before today. So we didn't need an order for this to begin happening. It's already happening.
In fact, how do you make an order of something that is already going on?
It was challenged in court, the arrival of that flight from China, and the High Court Judge James Macau said these 239 passengers should be traced. And
Muliro, do we agree that court order should be enforceable? Do we agree? Do we agree they have to be enforceable? I am saying we already have set up a mechanism that the minister you'll be exposed to, and I think you already have a brief on the same, where this team, the DG and the public health team, does nothing else from morning to evening. As flights come, the manifest is being shared. They are doing contact tracing routinely. So to be told you need to quarantine and put them somewhere, I think again it is in the spirit of the guideline by WHO. Let us not create panic. Let us not also have things which are not really enforceable, as it were.
I think just to clear that out once and for all, is that first of all, personally, I don't know who was served with a court order, because me haven't been served with a court order. But we don't need court orders to secure Kenyans' lives. It is not necessary. If you ask me, in law they call it void ab initio. And the point is that you know, people can go to court every day and come with 1,000 court orders. For us, the main focus is, do we have the capacity to secure Kenyan lives, irrespective of whether there is a court order or no court order? The decision as to how to secure health for Kenyans lies in a very strong and able team right here, you know, and they are able to tell you that this is necessary, we must do this. That is not necessary, it is not. It is, we have been, and they are the ones who have been managing this. The reason why we do not have, the reason why we don't have it yet is because they have been managing it. It is not just by chance that we haven't got situations that are happening in other countries, and some of them very, very advanced nations. Yes, please.
I think
This later.
Sorry?
Saying it's becoming a bit technical. Do you want to come on this later?
No, go ahead. Answer that. You can answer.
I have limited authority to support the Minister of Health.
Well, as you know, I told you I'm still training, so.
And I think really, to be fair to the minister, I would ask that you allow him to settle and take over the documents, the contingency plan, get briefing from the technical team so that he can be able to actually have a good conversation. He's done extremely well to even have responded the way he has. So I think, you know, we can create an opportunity which he will appoint for you to come and go through the details. I've hardly spent 30 minutes with him this afternoon. But on the other hand, you ask, who is this who has been trained? We have 3 levels of people who have been trained. The health workers manning the port of entry, the point of entry. All of them have been taken through sensitization. We have about 500 of them. Some from the health facilities, including the levels 5, have gone through sensitization. The other category is what we call the Ebola warriors. These are the teams of about 40 health workers who had volunteered with permission of government to go to Liberia when they were having a crisis in managing Ebola. They've all been brought back into the system, and they are supporting the health workers, and they are right now workers of the Ministry of Health, and they are supporting from the points of entry but also from the technical spaces, about 40 of them. Then we have senior doctors who have been trained specifically on the matter of coronavirus, a WHO training which was exposing all of us to the small details of how we can be able to detect and what it is we need to do and how we need to do communications. In the coming week, with your permission, Honorable Minister, it has been arranged that WHO is going to have the regional office, Afro office, is going to have a meeting here, and the regional director will be joining you from Monday, so that we can also be able to bring the media with a level of depth in sensitizing them in terms of how they can support this journey that you are beginning to work with them. But importantly, again, all the teams here, the technical teams here under the Public Health Directorate, have also gone through sensitization and exposure of what to look for with the support of WHO. That is why the issue of case definition, every time there's an alarm, most of them have, all of them have been false really, because all the cases that have been followed through have turned negative. The teams have all been exposed to what to look for, as it were. So those levels and layers of human resources have been exposed to this. What we are being asked through this executive order to do is for the minister to ensure that in terms of depth and coverage, it is spread across the nation so that everybody else is prepared and we don't have to expose ourselves to panic like has been detected in the past. Thank you, Honorable Minister, for listening.
Asante. And then I'll ask my colleague then to respond to her direct question. In terms of my strategy, I just want to reiterate exactly what I said, that the long and short of it is that what I want to achieve, and I think what has been going on, first, the wider part of it is UHC. What we want to get into place as a government is UHC. You want every person in Kenya to have healthcare, universal healthcare. You want to defeat this whole concept of people being impoverished because of medical care. So by the end of the day, whatever else we do, that's what we are trying to do. But I want to introduce to say just another smaller one. You want the experience between a health provider and a health customer, so to speak, to be a pleasant experience and for both of them to be happy. And that's a very pregnant statement, because what it means is that the health provider must come from a position where they have got the equipment to do what they want to do. They have got the capacity as human capital to do what they want to do. They have got both clinical and non-clinical skills, to treat the patient the way a patient ought to be treated. And on the other hand, on the patient side, the reason why one you come to see is because they have also taken what is called citizen responsibility, because we have to take citizen responsibility as well. Preventive issues in the country must be taken as seriously as we take curative issues. If we don't deal with issues of cleanliness in our country, so that we still have outbreaks of cholera, outbreaks of diarrhea and so on, diseases that basically occur as a result of some measure of lack of citizen responsibility. So as citizens, we must also take our own responsibility, as have been done elsewhere in other countries and in parts of this country. In some counties, they have taken it very seriously, and we can see the results in terms of the reduction of patients that we have. So we need to prevent people from going to hospital because they have taken measures not to do so. But we know we are human beings. We will get sick. And when we go to the doctors, then we also want to be treated well by the doctors. But in addition, we must also treat the service providers with respect and with the due concern that we need to.
To keep moving, we're coming to the end of these two questions. One is involvement of the labs. To confirm that we have 2 labs that have been attending to any suspected cases in terms of analyzing the samples. One is the influenza laboratory, which is under this ministry. The other one is a KEMRI laboratory, and both have actually been working back to back. Sample is sent both ways for us to be able to confirm the results. And so they are part and parcel of the technical task team that sits every day to be able to assess where we are at and what needs to be done. The second issue has to do with the FELTEP. Yes, FELTEP program continues to has developed or supported or capacity built a lot of the public health officers. As a matter of fact, the doctor heading the emergency response center, Dr. Kasera, is an alumni of FELTEP. And you will be happy to know that in the hospitals away from headquarters, we have several of the graduates of this program, and therefore when the public health team and the DG are linking up with the counties and the rest of the hospitals, this is the elite team that they are actually using to be able to do what requires to be done. So they are actively involved, they are actively engaged, and that is how come the level of our preparedness and confidence has been what it has been, because we have the requisite human resource. Is it enough? No, because we all have to go to on the vertical axis to move away from the elite team, the Ebola experts, You and I, like the minister has said, the technical team here, and I'm just inviting you one more time, help us in passing the messages, not creating fear or panic. I thank you.